Hi guys! Alright, I am so excited to have Dr. Willley here. Dr. Willley is my functional medical doctor, and a lot of you guys are here because of my perimenopause journey. You guys know I've been sharing this with you guys so much on my page, and a lot of you guys have seen my videos, you've joined my following for how I'm navigating my 40s and also how I was struggling in my 40s. So Dr. Willley is a family friend, but he's also my doctor. And he has actually saved me so much since I've been struggling. So we're gonna do a little live today to talk about kind of answering your questions, but also, talk about some things that I've been going through as well. So as you're jumping on, and we're kind of far back, so I'm kind of gonna try to read this at the same time. If you guys have questions as we're going through some of this, please feel free to ask. We'll try to do our best to answer them as well. I did put a question box earlier, and you guys asked some questions that we'll also get to. But we're gonna start with like some really basic questions. I'm used to doing makeup tutorials. You guys know this, so I'm always by myself.
I told her she could do some on me while we're here.
I know.
She said no hope.
You already look so great.
Oh,
I
yeah.
didn't need to do anything. So anyways, so this is very different for me too. So yeah, we're just gonna kind of wing this as we go. So Dr. Willley, all right, let's start really quick. I'm 43. If you're not following me, make sure you are. So I'm 43 years old. When I was 42, I came into your office and I was really feeling lost. I was feeling really alone, and you already knew me, so I felt really comfortable. Luckily, I know a lot of you guys are out there. They're struggling because they can't find somebody to listen to them, right? That's a common problem. They can't find a doctor that's gonna listen to them. So tell us first, what's a functional medical doctor?
Sure. So we look more for the cause of issues versus just treating a symptom. It's Western medicine is a very money-based system. Treat symptoms that cause other symptoms that cause you to be a revolving door in the practice. So what we do in functional medicine or integrative medicine or any type of medicine where we're actually trying to help people fix themselves is do just that. We help you fix yourself. Find the cause, find what I like to call the whys. Why is this going on? Attack that. So the goal being in my practice, you don't have to see a doctor again.
Which is amazing.
Yeah.
Because most times you have to go back and back and back and back. Yeah.
Mm-hmm.
Okay, so tell us this. With my videos and things that I put out, a lot of people are like, okay, I have a symptom, but how do I know I'm in perimenopause?
Oh, great question. So this is very interesting if you look at menopause by definition. By definition, menopause is a clinical event, and that's a cessation of your menstrual cycle for 12 months. On average, it's age 51 in America. So it has nothing to do with what your hormone levels are. That's a clinical event. And that's why some women go into their 50s, even 60s, still menstruating, and they would be considered not menopausal yet, which we all know the hormones are not where they should be at age 60 compared to age 30. If you actually look at the hormones themselves, they change up to 15 years earlier, Lauren.
Okay.
And so like in my practice, when I have a 35-year-old with symptoms, there's very likely that they are starting that perimenopausal journey, and let's do something about it. And one big reason that I jump on it super early with women is I do use the analogy of when you were a freshman, you gained 15 pounds. When you go through menopause, you're going to gain 40.
Yeah. Yes. It's usually the first thing too, right? Is women start gaining weight. They don't know why. Yeah.
If they don't have the classic hot flashes, night sweats, sexual dysfunction, mood disorders, which all of us husbands call it mood disorders. So you can't say that's a symptom of menopause. That's usually husbands. But anyway, different story. Then it's missed. Oh, you're not menopausal. You're only 43 or 42. But almost certainly the hormones are changing. And that's why, for example, after you're 40, there's a general rule for weight loss. You can't under-exercise or over-exercise your fat, and you can't under-eat your fat after 40. It's a hormone issue. Right. All the studies on less calories to lose weight, more exercise to lose weight, are done on teenagers.
Right.
We're not teenagers.
We're not, no, unfortunately.
Sorry.
No, not anymore, right? We want to be.
No,
I don't know if we want to be.
Here
Actually,
down, maybe,
yeah.
here up,
yeah,
hell no.
No.
Oh my goodness, no.
I don't want to go back there.
No, not at all.
So what you're saying is perimenopause can start in your late 30s.
Absolutely.
So a lot of women don't even know they're in perimenopause as early as 35.
Right.
So those symptoms can be starting as early as 35, and we just are not even recognizing that.
Yeah, because they're not necessarily the classic symptoms.
Yeah.
But they can be stuff like weight gain, even though you're eating right and exercising. It can be poor sleep. It can be harder time handling stress. Your sympathetic tone or your fight, flight, or freeze system is activated more often.
Yeah.
Your kids are pissing you off no matter what.
Yeah.
Those type of things we can
rage,
say,
yes.
yeah, what is this? There's definitely a hormonal component to it, because again, back to functional versus Western medicine, it's not X equals Y.
Right.
It's A, B, C, D, E, F, G, all the way down 25 letters to equal Y.
Right.
And
right.
when you're aware of that and consider that hormones in a wonderful woman of 35 plus may be a part of it, well, no, is a part of it. Let's just be honest. It is a part of it. What can we do about it?
Okay. It's interesting because a lot of women, even on my page, they'll say, well, I'm eating right, I'm exercising, I have no symptoms whatsoever, it's your mindset. And I get that a lot, like, it's just your mindset. And I'm like, it's not just your mindset, your hormones are changing. Like, maybe you don't feel it yet, but really, so hearing what you're saying is, it's not an age that it happens, but people notice it. It's going to be different for every woman.
It's different for
everyone. And I think
everybody.
that's a really important thing to say,
Very,
right?
very
Like,
important.
everyone needs to hear that. Like, it's not going to be your 35th birthday. You're not going to just be like, okay, I'm in perimenopause, right?
Exactly.
Okay, that's what we're here. Okay, so what I want you to do is tell them your background, because I'm going to read these comments because we're so far away from the camera. Will you tell them your background while I read these and just kind of like catch up?
Absolutely,
Okay.
yeah. So I've been doing functional medicine for many, many, many years, since the 90s. It wasn't called functional medicine then, it was anti-aging medicine or integrative medicine based on Andy Weil's work out of the University of Tucson in the 90s. And basically it's those of us doctors and healthcare providers that really want to help people help themselves. I learned early on, I was a resident at the Mayo Clinic, that pushing drugs and referring people to surgeons wasn't very rewarding for me. I like to see people succeed and do well on their own. So the best way to do that is give them the tools to do that. Having the basic understanding of human physiology helps me do that, and doctors do that. And that's kind of how I got into it, and I have been into it ever since now, going on 30 years.
It's amazing.
I know, I'm old.
You're not.
Oh, thank you.
Here's my thing too, is like, it's really hard. Another big question is women can't find functional medical doctors. So how do you suggest they find somebody?
There's worldhealth.net is the American Academy of Anti-Aging and Regenerative Medicine's website, and they have a doctor finder on there.
Okay.
And they're one of the biggest ones. The Institute of Functional Medicine also has a doctor finder on their website.
Okay. And what's the difference between like a naturopath versus a functional medical doctor?
So a naturopath can be a functional medicine doctor. Their training is in naturopathy. So it's a different type of training, really focuses on herbs, really focuses on all alternative stuff, though the newer schools like in Bastyr, which is in Oregon, and I can't think of the university, and it's in Tempe, Arizona, they really focus on both Western and naturopathic treatments.
Okay.
Wonderful physicians down there. As a matter of fact, in Arizona, a naturopath can do everything I can do.
Oh, that's interesting.
Yeah.
So that's a good option if
That's
someone
a great
is looking
option,
for that.
yeah.
Okay.
And there's chiropractors out there that are functional medicine trained, nurse practitioners, physician's assistants. It's really kind of ballooned. It's taken off. When I first moved here, when I met Lauren and her husband 20 years ago.
Long time
Holy
ago.
cow, girl. I was outcast because of what I was doing.
Yeah, you were different, huh?
Oh, yeah, I was different. But now all those same doctors that used to ridicule me are now my patients.
That's so funny.
So, yeah, it's funny.
Full circle, right?
It's full circle. Yeah.
Well, and now everybody they all want that information, right?
They want, yeah.
Well, and so okay, going into that, a lot of people, let's talk symptoms.
Okay.
Because reading the comments right now, I'm trying to think of a natural way to go into this. So the symptoms that everyone are really experiencing right now are anxiety. And I don't know if you want to break this down. So anxiety, bloating, weight gain, joint pain. So should we start with those?
Sure.
It's kind of like a big bag of worms to hand you,
Absolutely.
but okay.
No, I can get very...
Okay.
Just
Do you want
stop
to
me
take
if I'm
it?
going
Do you
too
want
far.
it? Because I want to go into HRT, But I don't. Do you want to start supplements, or do you want to I don't know the natural transition?
Why don't we cover why those wonderful women are experiencing some of those things,
Okay.
and then we can go into different treatment options.
You are the expert.
So,
I just deal with the symptoms.
Let's start with the first one, anxiety.
Okay.
Very, very common. Anxiety and no sleep kind of go hand in hand.
Yeah, night anxiety. I had that horribly.
Oh, absolutely, yes. Yeah. It's a combination of just the stress of the world. I mean, politics, worried about our kids, worried about that stress. There's a different thing. People would call that adrenal fatigue or cortisol issues. It's actually more sympathetic tone. And your sympathetic nervous system is your fight, flight, or freeze system. That's not supposed to be turned on all the time. And when it is, you don't sleep and you're anxious, you're high. On a hormonal aspect of that, as you get older, it's actually progesterone that helps with that. Okay. Progesterone is a precursor to gamma aminobutyric acid, which is, out of all the hormones God gave you to run away from a saber-tooth tiger, you get one hormone to go to bed, and that's GABA. Okay. Progesterone feeds GABA. So when women are estrogen dominant, which brings us to bloating, belly weight, heavy stuff, the hormones are partly processed in the gut as it is, but gut health will change the way progesterone is made. In other words, they become too estrogenemic. In other words, their estrogen is so high, especially if your weight gains here to here, then compared to what we call the progesterone to estrogen ratio changes, and you're not getting the benefits of progesterone. How does that show up? Anxiety, poor sleep.
Okay.
And then that brings us back to the bloating, belly stuff, weight gain. That's a lot to do with gut health. And because you can't separate those things.
They all go together.
They all go together.
Okay.
And the basic rule is if you live in America, you have a gut problem. And even if you don't have the classic bloating, diarrhea, nausea, vomiting, constipation, whatever, classic irritable bowel syndrome symptoms, you live in America, you have a gut problem because of high stress, which causes the gut to break down. That's also called in the alternative literature a leaky gut, which changes hormones. If you look at all your hormones, especially the neurotransmitters, your happy hormones like dopamine, serotonin, your energy hormones like norepinephrine, your all those hormones, only 10% are up here, Lauren.
Oh.
The other 90% are right here.
That's interesting.
That's why we call the gut the second brain.
Interesting.
That's where the neurotransmitters are. So when you have a gut problem, you have a brain problem.
So the brain fog, does that go with all that too? Because a lot of women are experiencing that too.
Hand in hand. And that's where, since our topic's hormone replacement, optimizing hormones when there is that imbalance that is not recognized by most doctors, starts fixing everything. It helps women feel better so we can address issues of the gut health, so we can address issues of stress, we can address issues. And when you do that, Lauren, weight loss becomes the side effect. Okay. It's not a goal anymore. It just happens because you're getting healthy and you're fixing the hormones behind the scenes.
So basically, okay, well, I don't want to go quite into that quite yet because that's a whole other thing. Okay. So I know you're saying like with the HRT, hormone replacement, that's going to fix everything, right? Because you're balancing everything.
Everything's
I want to make sure I'm really elementary. Sure. So, and I know a lot of people are too. So most people in America, let me make sure I understand this. Most people in America have gut issues. So if you're dealing with brain fog, if you're dealing with weight gain, if you're dealing with bloating, it's all going to be in the gut. Elementary, is HRT the answer, or are there other things we can do to fix that? Diet, exercise.
So it's all about HRT is part of the answer.
Okay, that's what I want to know.
Especially when there's that imbalance.
Okay.
But you have to look for that imbalance, and it's not really recognized on standard lab testing.
That's what I want to know.
Normal values are this big, when really optimal values are this big.
So why, when people go into their general practitioner, they're doing their blood work, and they're like, "You're fine," but they're having all these symptoms?
They fell in within the normal values. And that is not a good way to interpret labs. Okay. Because I don't know anybody normal. I'm not normal.
Right.
And really, there's so many variables involved with what's right and wrong. And the problem with Western medicine in general, not to get all philosophical on you guys, but if you look at how we view labs, how we view scientific experiments stuff, one of the rules of Western science is to remove the observer. That supposedly takes bias out. How can I draw your labs, Lauren, and then not listen to you?
Right.
That's removing the observer.
And that's what's happening to so many women. They're not being heard. They're just looking at the labs and they're saying, "You're fine." Yep. It's in your mind. You're fine.
Exactly.
And then
'Cause you're
looking
normal.
you're looking at the depression rates and the suicide rates of women, and they're going up. And that's the craziest and the saddest thing, right? Like,
Yep, exactly.
okay. So there you go. There you go. Find a doctor that'll listen to you, correct?
Yes, exactly.
Yeah. Because you know your body best. And that's what I keep telling women.
Absolutely.
I'm like, you know your body best.
Yeah. It's
So.
in my practice, you are a variable of one.
Yeah.
You're my experimental one. And nothing else matters when I'm sitting in front of you.
Exactly.
So
I love that. Okay. All right. I got us off topic. I swear, I'm like, woo, all the time, right? Okay. Where were we? Do you
we
remember?
were talking about we talked about anxiety, bloating, weight gain, hormones, other treatments.
Oh, yeah.
So yes, dietary huge, exercise even huger. Is that a word? Huger.
I'll take it.
I like it. Bigger. Stress control.
Yeah.
Very important.
How do you manage your stress, though, as a woman? I'm going to keep reading these comments.
yeah.
Sorry.
How do you manage your stress? Well, the obvious stuff like taking time to deep breathe, meditation, prayer, grounding or earthing, which is simply going outside and standing in barefoot on some grass for 20 minutes. You should see the studies behind that. Huge.
Grounding's huge. Yeah.
Grounding's huge.
Yeah.
It's amazing. It's the way we were supposed to be. Those are ways to do them modality-wise, if you will. As far as personal-wise, getting those hormones balanced helps with anxiety. Having good relationships, talking to people, counselors. There's nothing wrong. There's such a stigma in our country about talking to a counselor. And I don't think there's anything better that can go on. Even healthy relationships benefit by talking to counselors and talking about stuff. So handling that stress is absolutely vital. And I tell my patients all the time, I can't change your stressors, but I can help your body and brain deal with them better.
Yeah.
And that brings us full circle to what are your hormones doing?
Right. Okay, here's some questions for you, okay? Before I forget.
Oh, you're good.
Okay, couple of things. We already talked about how do you know if you're in perimenopause, but can you give a quick answer one more time for that?
If you're over 35, you're probably getting there.
Okay, perfect. That was great. And then really quick, can doctors do a hormone level checks through blood tests at a start point?
Yes, so when we do blood tests for hormones, it has to be done at a very specific time. Those variables you have to account for. Time of day. Hormones are very circadial. In other words, they follow the sun. So always do hormones first thing in the morning between 8 and 9 a.m. For both men and women. Fasting, because food changes all your hormones, not just your blood sugar and your insulin. And then no exercise prior to your blood test.
Oh, okay.
Because exercise also changes the hormones. Then, depending on where the woman is in her cycle, it's also important to count that variable. So if I have a woman that's trying to get pregnant, dealing with infertility, I'm going to test her hormones mid-cycle, around ovulatory time, to see that balance. If they're no longer want children, but they're thinking they're having hormone symptoms, I'm going to check at roughly day 21. We call that the late luteal phase.
Interesting.
And if a woman's cycle is completely haywire and wacky, then we try to do it on the first or second day of actual menstruation. So those variables are very important to help us read and evaluate the labs appropriately. Again, now I've included you into you. The observer is now part of the equation, and that's so important.
Yeah. Okay, that's a lot, and I don't think a lot of people knew that. I didn't know that.
I get referrals from wonderful doctors all the time. I did a hormone panel. I didn't see anything, and the first question out of my mouth is, "Oh, where was she in her cycle?" Dead silence.
Yeah.
Oh, should I account for that? Send her my way.
Yeah, because I mean, when even me getting my blood work done, no one asked me. I just went and got my blood work done. Okay, good to know.
Gotta control the variables when you can.
Dot patch I'm on, what would you recommend? Is that a good one to be on?
Oh, that brings up a great
is that totally
discussion.
Jumping? Is that okay?
No, it's okay. It's important to know that hormone replacement for women, there's actually 8 delivery systems: shots, pills, patches, creams, gels, sublingual, oral, pellets.
Yeah, this is a good.
And vaginal preparations, 9.
Okay.
9 different delivery systems for hormones that we personalize based on your needs, your environment. For example, in a young woman with young kids, I'm less likely to do the topical creams and gels, because if a 6-year-old little girl watches mom put the cream on, 6-year-old girl puts the cream on, guess who hits puberty? Right then.
We talked about that.
Yes.
Yes, I remember
I have
that.
actually seen a 6-year-old who had pubic hair because she got into mama's cream.
Oh, yeah, okay.
Yeah, so that's a variable that you have to discuss with your doctor, saying, okay, cream's maybe not the best for me, maybe I'll do pellets. And those are just small little compressed hormone pills we put under your skin in your upper cheek area, and they dissolve over 4 to 6 months. There's just so many delivery systems. You have to pick the right one for you. As far as efficacy or how they work, very similar. Just personalize it.
Okay. This one is, when you say HRT, is that one hormone or a series of different hormones?
Oh, great question. So in general, hormone replacement therapy, or BHRT, bioidentical hormone replacement therapy, people think sex hormones. So estrogen, progesterone, testosterone, DHEA, pregnenolone would probably be the top 5 in HRT. When you talk to someone like me, when you say hormones, I think of 65 hormones. So it's a little different. But when people say HRT, it's usually the sex hormones.
Okay. Yeah, because it's very generalized when I say it, because I don't know anything.
Right. You know a lot, but...
I know like this one. Okay. I'm learning.
Yes, you are.
Right?
You're very good at that.
All right. If someone is unable, are there people that are just unable to take hormones?
If you have a very... So breast cancer is always a big question. If 5% of cancers are genetically related, that's not a big number.
No.
It's still the environment that really, stress levels that really dictate how and when someone gets cancer due to immune dysfunction, gut health, the list goes on and on. As a general rule, if you've had cancer in the past, we just make sure all the I's are dotted and the T's are crossed. So it's not necessarily a contraindication when you really understand what's going on. Mm-hmm. So to answer your question, generally, anyone's a candidate for hormone replacement if they're a candidate for hormone replacement.
Okay. Did you hear that, ladies? Because you ask me this question all the time.
Yeah.
And I don't know the answer, but now I do. Okay. What are some natural remedies? You've got me on a lot.
Okay, yeah, that's a great question. One of my favorite natural remedies is derived from broccoli. It's called DIM, diindolylmethanate.
I love that one.
Yeah, it's a great one.
Yeah.
That one changes the conversion of estrogen away from the inflammatory estrogens, 16-hydroxylated and 4-hydroxylated estrone. I'm going to quiz her later on that.
Oh, shoot, I wasn't paying attention.
And then drives it towards one called 2-hydroxylated estrone, which is the anti-inflammatory cancer protector. And that's why broccoli protects against, and cauliflower and the whole class, protect against hormone-related cancers, prostate in men, breast, uterine in women. Mm-hmm. So DIM's the top one. Mm-hmm. Making sure liver health is optimal is very important. So I like phosphatidylcholine, which helps because statistically speaking, 80% of Americans have something called non-alcoholic fatty liver disease. That's a precursor to diabetes, hypertension, hyperlipidemia, all these issues, anxiety. So optimizing liver health is vital for oral hormone health. And then using supplements like saw palmetto for acne in women lowers active androgens.
Because hormonal acne is something that can occur.
Yeah, and saw palmetto is a great little solution. We use that in men's prostates, but it works wonders for women's acne.
Is
it's androgen driven.
Is that a pill or is that something
it's
that's
an
injectable?
over-the-counter supplement.
That's something, because a lot of women actually ask me about hormonal acne. So what is that again?
Saw palmetto. The doses are 300 milligrams a day. It's in any health food store. It's all pretty much standardized. Very safe. But again, there's already a lawyer listening.
I know.
Talk to your doctor about this.
Talk to your doctor about any of this.
Exactly.
Don't get us in trouble.
Yeah.
Okay. What about over-the-counter supplements for anxiety? Let's just go through a quick list.
Oh, sure. Yeah. My favorite would be the adaptogens. So ashwagandha, relora, holy basil, rhodiola, magnolia bark is my favorite, DAHP. Mm-hmm. I call that God's Valium. It's incredible for anxiety.
That's the one I'm taking. I love that one. Yeah.
It's incredible.
Dude, right away.
Oh, right away. It's
love
amazing.
That one. Yeah.
And then for an acute anxiety attacks, L-theanine, the amino acid that's in like sleepy time tea, that's just L-theanine. Very calming because it stimulates GABA again. Okay. Those are your best.
Weight loss.
Weight loss supplements or how to do it in general?
Oh.
Cut off your right leg. No, just kidding. Don't do that.
Heavy weights, right? I'm a huge proponent in this.
Lifting weights is very important. Exercise, just moving.
Yeah.
There's a lot of people that aren't able to do it. And here's a mistake I've made the first 20 years of my practice is I would prescribe diet and exercise to people that didn't feel well.
Yeah.
That's not a good idea.
No.
I wasn't very
good
bright.
About yourself, right?
Right.
Yeah.
So what I do in my practice now is I tell them, simply do this. Go walking for 30 minutes after your evening meal, weather permitting. Just start there. get feeling better, and then you'll want to do more. Because yes, weightlifting is essential for long-term weight loss maintenance.
Yeah.
Yeah.
Yeah. But
Diet,
you might not be there. So
right,
that's true.
yeah. Dietary stuff, there's so many dietary options. You need to find the one that works for you and your family forever. Don't do these fads. Don't do ketogenic today and then paleo tomorrow and then... That's too confusing. Talk about anxiety. The hell am I supposed to eat today? Now I'm anxious.
Well, and depression, right? Because you're like, I'm failing. And I think I think as women, we always feel that way. Like, we're just like, we're not good enough, and we don't want that. So, okay, one more. We'll do, bloating. That's a good one. Women are really struggling with that. I struggle with that. What's something we can do for that?
Oh, gosh, there's a huge range of stuff like that. Even exercises, those hip thruster exercises everyone does, and I see them online. Yeah. If your iliopsoas muscles, which are big primary muscles here, are overtrained, you will bloat.
Really?
So exercise can actually cause bloating. So
wait. What are we not supposed to be doing? Because I might be doing that.
So it's when you put weight around your hips, you lay
on
your back.
On the bench and
you throw your hips up in the air.
Don't do those.
You think it's building your butt. It's actually stimulating the iliopsoas muscle, which can cause bloating. So one of the first things I do with my patients that are bloated, I tell them to stop that exercise. Okay. And then it's finding if there's a certain food that does it. And I like to emphasize that there's no such thing as a bad food. There's just bad diets. Yeah. So maybe you're a little gluten insensitive now. Maybe you should avoid dairy now to heal and do better. But that doesn't mean those foods are off the table forever.
Oh, interesting. So it's not off the table forever.
No, it's not. It's get that gut healed, and then all foods back in play.
And then you can add it in slowly. Mm-hmm. Interesting.
Supplements that help bloating, the enzymes, papaya enzymes, probably my favorite.
Oh, really?
Yeah, just chew on a couple papaya enzymes. They taste really good. I call them after dinner mints. With all your meals, works wonderful. If you have
at a Whole Foods store or something?
Yeah, okay. Papaya enzyme, anywhere.
Okay.
If you have a lot of intestinal issues, loose stools and stuff, you want to make sure you're absorbing your fat. So using something like oxen bile, I know that sounds weird, but if that helps you body absorb your fat, especially if you've had a cholecystectomy, if you've had your gallbladder removed, you probably need oxen bile with high fat foods, so it's absorbed better. That'll also help with bloating. And then there are functional medicine gut health tests. In my office, we call it the poop test, where you collect your own stool and send it off to a lab, and I get to see everything about your colon.
Okay. So you should have that checked probably, too.
If you're having a lot of gut issues, that test is golden.
Okay, we've got so many questions, and I feel like we've been going really long, so I don't want to, maybe we need, a part 25, but I'm just teasing.
With you, girl, I would do a part 25. Do
you guys think we need a part 25? I'm just teasing. Okay, I know you guys asked me a ton of more questions, and I want to just do, I'll just ask, let's just do quick question answers. That work really quick. Okay.
Me quick? Okay, do my best.
We'll do it really fast. Okay, one thing people really are frustrated with functional medical doctors is insurance doesn't cover it. Mm-hmm. What's the normal cost if they were to see you? Not you, but just in general.
In general, functional medicine doctors are more expensive. They usually, most of us do plans because it's not the meet, greet, and street like Western medicine has trained you in. It's not take a pill. See, I told you it would be short.
I know.
Don't take a pill and go home and call me if it doesn't work. It's okay. Let's work on your lifestyle. Let's work on your stressors. Let's balance those hormones. Let's get your gut healthy. And that's a process. So the way most functional doctors work is to have you pay for that process. 3, 6, 9, 12 months worth. So it's going to be pricey. I would say on average in the country it's $6,500 for a 6-month
plan.
Complete revolutionary change in you and your health. And then the cool thing, yes, that's expensive, but you're worth it and you can't take it with you.
Yeah. It's like your life.
Yeah. Oh, yeah.
You're trying to have a longer life.
Yeah. Well, this.
And a better life.
You do. Yeah. It's, to me, I consider myself a quality of life physician. Yeah. There was a time when I could keep people alive in the nursing home or in the ICU for a long time, but that spoke nothing of quality of life.
Yeah.
I don't do that anymore.
I know.
If God says you're done, you're done.
Yeah, it's like, how do you want to live? I know.
Live great until then.
Okay. These are not short.
I see, I told you. Me short doesn't happen.
Even this, I'm like, these are not very short. Okay, hair loss. A lot of people are really worried about hair loss. Okay. Do you have something quick?
Yep, absolutely.
You can give them?
Quick. Okay, almost everybody and their brother on Ozempic, Mounjaro, Trulicity, one of the GLP-1s, glucagon-like peptides, those cause hair loss.
Oh. Because that was another question for you.
If you're doing one, those cause hair loss, period.
Really?
And using stuff like over-the-counter minoxidil may help a little. We use in our practice exosome treatments, where we actually inject
Is that
exosomes.
oxygen?
No, it's I can't say it, but they're related to stem cells, but they're not stem cells. I'm not allowed to say that. The FDA doesn't like that.
Don't say that.
They're biological tissues that help stimulate growth of your hair follicles.
Okay.
The other cause of hair loss, hormone imbalance. Estrogen to progesterone ratio, too much androgens, too much testosterone, too much DHEA. Again, an imbalance. And there's a lot of clinics out there that are doing like hormone pellets, and they load up these women with testosterone, causing male pattern baldness. That's a problem.
That is a problem. What about collagen? Could you be doing that? Would that help at all?
Collagen, I can think it'll help. The deal with like collagen protein is once you swallow it, your body doesn't know it's collagen protein. It's a protein. So I don't have a problem with it, but I think it is more expensive compared to...
Wait. Because I'm...
This isn't short.
Wait a minute. Okay, but because I want like a liquid collagen. Is that worth my money? It's expensive. I haven't
seen good enough data to say yes. I'd say there's a lot of hype on what it's used for in the body, but when you swallow it, does your body use it for that? Unknown. It's theorized it is.
Ladies.
And a lot of people swear by it, and again, you're an experimental one. If it works for you, go for it.
Yeah.
But if you're looking at costs...
Yeah, it's expensive.
Expensive.
Okay. Who knows? All right. Okay. I'm trying to make these short. What do you think of Ozempic? Okay.
Oh, yeah, the GLP-1s, I love them. I've been using them for years. They're not new. They've been around forever. They were actually first designed and studied for treatment of Alzheimer's disease, believe it or not. They are great peptides. They change serotonin and dopamine in your brain. They work on glucagon and insulin in your gut. They do slow down gut transient time. That's part of the way it works with weight loss because people are full longer. So there are some gut side effects with them. If you're GLP-1 deficient or resistant, you're going to respond real well. If you're not, you're going to get real sick.
Okay.
So that too is an experimental one. But again, it's just like any other trick. If you do nothing else but take that and lose weight, you're going to gain your weight back.
Yeah. So you got to really work with something.
I can honestly tell you, I do not have patients gain weight back because if we're using a GLP-1, we're also using growth hormone support. We got their hormones balanced, we got their gut fixed, and then they can come off that stuff and they don't gain their weight back. It's a big picture thing. It's not just,
big picture. I agree
again, our thinking, the way we are trained, meet, greet, and street, that's Western medicine. And that is not lifestyle medicine.
Yeah. Okay, if you could tell someone going through perimenopause or menopause, one thing, they're struggling really bad, they feel super lost, super alone, they don't know what to do. One thing, what would you tell them?
Pray and meditate, start with, and then get some like L-theanine or some DAHB just to calm your brain down so you can think through what's going on. And then ideal world, find someone like our clinic here to help direct you. Because really my job is, I'm just an educator. I'm going to teach you based on you what's best for you, and then you do it.
Yeah. And with you too, like you always give a plan, and then it's like kind of up to me, like what do I want to do with that plan?
Exactly.
You know, so it is really based up to that person, which is really cool.
Absolutely, yep.
So, okay, where can we find you? And you knew I was going to ask you this.
Yeah, that's good. You know what? My wonderful PA is standing right here. And what's that website, buddy?
I can also post it if you don't know.
Oh, you know, let's do that. We'll post it.
Okay, we'll post it.
Because we're just changing some of our websites and contact information. So, and I'm absolutely illiterate on those. So
we'll get it all up, and I'll also put it on my website too, so you guys will have it easy to find. You're welcome. But thank you, Dr. Willley, so much for your time, and you guys, maybe we'll do a part 2.
I love it. Yeah, this is so much fun.
So if you guys have questions after this, make sure you just ask in the comments. I will post this on my page. Seriously, thank you so much for your time.
Oh, my pleasure.
I appreciate you.
Sorry I talk so much.
No, that was so awesome. So awesome. And I hope I answered, we got most of your guys' questions answered too. So, all right, you guys, have the best weekend, and we'll hopefully do this again soon.
Yes.
Okay?
Thank you.
Bye, guys.
Bye.
All right.